Well, it's good to be here again this afternoon. And today we're going to be talking about optimizing your brain. This is actually a subject matter that we teach in a college course at Weimar. One of the general education requirements for anyone that gets a degree at Weimar is to take Optimize Your Brain, and normally it's a freshman class. So we have a lot of freshmen at Weimar, and in fact, on this Wednesday, they're taking their final exam, Optimize Your Brain. But half of their grade is actually not based on exams or quizzes or things like that. It's based on actually participating in the habits on a regular basis that will optimize their brain. And of course, this is important at the beginning of their college careers to have enough intelligence to be able to learn, retain, and apply knowledge, as well as enough emotional intelligence as well. Interestingly, yesterday at the meeting of the presidents of the universities in California, I was mentioning what we do at Weimar, and they were all very interested in the course, the Optimize Your Brain, because they also go through a screening test. They actually take a test at the beginning to see what their emotional intelligence is. We're able to identify whether they have depression, whether they have anxiety, and those type of things, and be able to offer resources to those that have mental health challenges. Fortunately, at Weimar, we're not at the 60% of college students that have a mental illness. I think, and it's not zero, but I think among this freshman class, if I'm remembering correctly, it's actually 10%. And so far different than it is at UCSF or even Stanford or those places. But still, we want those 10% to be able to be helped. And of course, the 90% need to improve their IQ and EQ, which the program will do. So there's multiple things they learn in regards to optimizing their brain. But I'll start out with a text that is actually the last chapter in the Bible that says, "And they shall see his face, and his name shall be" where? In their foreheads. Now, what's there in the forehead? The brain, and particularly what portion of the brain? The frontal lobe. And this is where IQ and EQ come together. According to results of a study that followed thousands of students through their college careers, the higher education system is effectively broken. By the way, this is the higher education system. For those of you that are educators, this is the college and universities. The highest form of higher education, or it's considered the highest form, is called regional accreditation. And by the way, regional accreditation is going to be no more in another year. Regional means that that they just accredit in a certain region. For instance, you can't utilize our accrediting body up here in Oregon. It's only California that has the WASC, and of course California prides themselves, and I actually think they may be right about this, because we are accredited by them, but they pride themselves as having the best accrediting university system in America. In 2020, as a result of what the Department of Education is doing at the federal government, they're getting rid of the regional part. So in other words, in 2020, an Oregon university might be able to select the accrediting body in California to accredit their university. This is now going to be competition. Before, they all had a monopoly. In their region. There was only one regional accreditor, and you went to that one regional accreditor to get it done, but now there's going to be selectivity going on. But of course, Stanford is accredited, as I mentioned, by this regional accrediting body, and others are as well. But interestingly, the results show that many students are leaving college with degrees, but little to no improvement in critical thinking or complex reasoning skills. And of course, you're thinking that's why they're coming. You know, this is why they should be coming to an accredited university. But we're finding out they're getting degrees, but their brains are actually not improving. Their ability to analyze things are not improving. Their complex reasoning skills are not improving. And of course, this is quite new because prior to this, colleges and universities seem to be able to greatly enhance this. This was a study of 2,322 typically aged college students, found that a whopping 45% showed no improvement in higher reasoning and critical thinking skills after 2 years. After 4 years, 36% managed to get a 4-year degree with no improvement whatsoever from the time they were in high school in their complex reasoning or critical thinking skills. Now, let me ask you a question. If those people did not go to one of these high-end universities and instead had to work every day on a farm in 3 dimensions with their hands, do you think their complex reasoning skills would have improved? Actually, far greater likelihood. And so we're kind of in a dilemma situation where the brains actually develop better in some cases when you don't go to any colleges and universities. And you actually, do things out in nature and work with your hands and those type of things. Why is it improving with that? Well, the frontal lobe actually continues to develop for 30 years. So if we're giving it the right nutrition, so to speak, the right environment for it to grow, we ought to be able to significantly improve in complex reasoning skills and critical thinking from age 18 to 22. Now, I don't know if if any of those other college presidents that I met with yesterday would tell you what I just told you here today. It seems self-defeating, when you're ahead of a university to say that you might do better not going to that university and actually working with your hands outdoors. But we are in that dilemma today. The study also found that although more selective schools had higher overall success, all 24 universities involved had small groups of presumably self-motivated kids who were learning a lot among a majority who were just getting by. So some of them were actually doing very well. The most successful students tended to do what? Work on their own rather than studying or working in groups. Now, this is something that also really baffles the accrediting bodies because the accrediting bodies love to see students work in groups and have all of these group activities and group sessions and those sorts of things. But they found out those who were actually more of the loner types did better as far as their overall critical thinking. While one aspect of this could have to do with self-motivation or simply study habits, another reason that surfaces is that these students don't like to group up because the majority of those groups are kids from the 45% who still haven't grasped critical thinking. In other words, it puts them behind and it's kind of waste their time to get involved in these group activities when they're not really enhancing as a result. Many graduates, yes, people who graduated, had trouble sifting fact from fiction. If you take a look at what they were measuring as far as complex reasoning skills, this isn't rocket science. They're actually measuring their ability to sift fact from fiction. They're measuring their ability to address subjects objectively. They're measuring their ability to reconcile and analyze conflicting reports of a single event. And they are asking graduates to make decisions and arguments based on what? Facts and logic without being affected by appeals to emotion or political spin. But it turns out our students can't do that as far as nationwide. They're having lots of trouble being able to do this sort of thing. In short, these are things we would tend to ask from functional citizens, whether they have a degree in art, history, biochemistry, or nothing at all, but they could not be performed by a large percentage of college graduates from prestigious universities. And the author of this study, that comes from one of these prestigious universities, has written a book called Academically Adrift: Limited Learning on College Campuses. And it has produced some waves in the academic world because it's helping people and helping accrediting bodies to realize, with all of their criteria for accreditation, those criteria are not necessarily helping the brains of the students by going there. And of course, one of the primary reasons why they are not helping the brain has to do with the fact that a lot of their learning is not enhancing the front part of the brain. The front part of the brain is where creativity is going to occur. It's where thinking outside the box is going to occur and those type of things. And it's also, although all aspects of the brain are involved in intelligence, it's also where intelligence is centered. So what is intelligence? It's your capacity to learn, retain, and apply knowledge. And it sounds pretty simple, but of course it can be involved. It's often measured by an IQ test, but IQ tests are known to be inaccurate, and about 20% of individuals will greatly overestimate some people's IQ who are good test takers, and it will greatly underestimate other people's IQs who are not necessarily good test takers. IQ has been shown to be related somewhat to academic performance. However, EQ is more related to academic performance because of the motivation part. You know, you can have someone with an average IQ who's really motivated and they'll study hard, and they may get a 4.0, and someone where learning comes easy to them is not motivated and their grades are not so good. So IQ is related to academic performance, but it's not as related. College graduates' first job, however, after graduation has been found to be related to their IQ. And this is one of the reasons why I've given Optimize Your Brain seminars in different places in the country. And normally, the typical people who come are those who have high school age students, and they're coming and making sure these high school age students sit on the front row of this Optimize Your Brain program, because they're wanting those kids to optimize their brain so that they can get into these Ivy League schools and be able to successfully complete an Ivy League degree, because the studies show that they're much more likely to get a six-figure income right out of college if they are able to get into the right school and get the right degree and those sorts of things. But interestingly, the studies show that once you get your first job, your promotions in that job are no longer related to your IQ. They're actually related to your EQ. You know, that's what Christy found. For those of you that were here this morning, I talked about Christy, who was having problems in her job performance and a lot of issues there. And after the program, and when she came back to successfully complete it, because she had only done the 3-day program on the first round, after successfully completing that, she kept getting offers for higher jobs, not even applying for them, but people were noticing the improved emotional intelligence, and you should be actually the manager of our unit, and so she was being asked for leadership positions because of this emotional intelligence. A lot of students, though, when they're being passed up, they've done well in school and they've gotten 4.0s and those sorts of things, and they come to our program and they haven't done well. Sometimes I'll ask them, why is it that you think you've been passed over for promotions? And they often tell me it's because my boss does not have a high enough IQ to recognize my IQ. And that's actually not the reason. They learn that by the time we go further, but it's because their boss is recognizing their lack of EQ that's the issue, and that's why they're being passed over for promotion. But there are advantages of higher intelligence. We shouldn't underestimate it. You're more efficient in studying. Is that a good thing? Yeah, because you can go to a very difficult school and still get exercise and still get enough sleep and still have a devotional life. By the way, those are three things that we look at all the time. If your life is in balance, you ought to be able to have a regular exercise program, you ought to be able to have a regular devotional life, and you ought to be able to get adequate sleep, even, Sunday through Friday and not just on weekends. And if you're having to catch up on weekends, it's a sign of imbalance somewhere. And so, and of course, if you have a high enough IQ, you can live a balanced life in regards to this. In fact, it reminds me a little bit of I'm getting ahead of myself here, but one of our speakers at our EQ Summit coming up is become very famous because he is a Generation Z guy who is a multimillionaire, and he makes his money actually computer programming, so he's a computer guru, but he spends 0 time on entertainment TV, 0 time on entertainment internet, and he's never had a social media account. He actually refuses to have a social media account. And he is sought after the world over because of his brain's abilities in computer programming and being able to solve complex computer-related issues, which he realizes related very much to the lifestyle he chose to never have a social media account. And so he's very much into optimizing your brain, but he talks about how as a multimillionaire and making over $1 million a year, I still sleep well every night, I still have a balanced life, I still have time for this, I still have time for all of that. But one of the reasons is because he doesn't do anything in regards to his regular schedule to suppress his frontal lobe, and that's why he's able to have all this extra time in regards to living a balanced life. And he says some people will say, well then, how are people going to know about you if you're not on social media? And he says, if you are at the top of the field, they will find you. And he says they're going to find you. And it was difficult for me to actually locate, to be able to communicate with him, for him to come to our EQ Summit. Because we couldn't contact him in the normal computer ways. But when you're very good, people will find a way of reaching you and finding a way to contact you. But this is one of the advantages, of course, of higher intelligence. You're more efficient in studying, you're more creative, you're more logical, you're more persuasive, your influence goes up, you're more likely to become wealthy. And if wealth is a high priority for someone with high IQ, they will become wealthy, as we'll talk about. But for many people with high IQ, wealth isn't even on the top 10 priority list. So there's a lot of people with high IQ that are not wealthy. Another advantage is health-wise. This was a study by Harvard University. Large study over many, many years showed that up to the cutoff point of 163, this is on IQ. Does anyone know what the average IQ is? It's 100. Every 10 points is a standard deviation, so 163 is an extremely high IQ. That's way up at the very top. Participants' risk of dying during a given period decreases as their IQ increased. In fact, those with a childhood IQ of 150 had a 44% lower risk of death than those with an IQ of 135. And so IQ actually increases your longevity. Now, at the time that Harvard study was published, let me go back to it. Harvard study was published in 2005 there. They didn't know why. They were saying, this is new. IQ is a variable for longevity and how long you're going to live. And they were wondering, why is that a variable for longevity? Now, it turns out after this, we discovered it, one of the reasons, a couple of the reasons, and we'll go into this here in a little bit. But of course, there's more lobes of the brain. There's the temporal lobe. This is actually where memory is stored. And this is an important part. Now, your working memory, and this is something we'll hopefully have time to get into this a little bit more this afternoon. Your working memory is what you are learning and what you're able to keep in mind for about 30 seconds to a minute. And if you are engaged enough, or if it's interesting enough, or you're intentional enough, that's when it can get then transferred over to the temporal lobe to be stored. I can tell you a lot of our young people today are having problems with their working memory. The working memory is actually in the frontal lobe of the brain. It's the anterior cingulate gyrus of the frontal lobe of the brain. And one of the primary reasons why we're seeing this anterior cingulate gyrus not being able to work very well in working memory, anyone want to guess what the reason for it is? It's particularly declined after 2007. What happened in 2007? The invention of the smartphone. And what is happening among our young people with smartphones is they get on their smartphone to do something useful, but within 90 seconds to at most 5 minutes, they're no longer doing anything useful. Why not? Because somebody did a Snapchat. There was an email notification from somebody. And then there's a news flash that Donald Trump said something about another woman, and they have to check it out. And so they're driven to distraction. These devices are very distracting. And of course, the engineers that are engineering all of this are actually designing you to get distracted. In fact, they're all trying to gear up to be the most distractible thing that comes across your screen. And then they actually try to find out more about you. Do you like BMWs? If so, within 5 minutes, there's going to be something about a BMW flash that goes across quickly so that you click on that and get distracted about that. And so, as a result, this anterior cingulate gyrus that never has to focus on anything for very long begins to shrink. And we'll actually see it in the MRIs. It shrinks down. And this is why in the present generation, if there's something even highly interesting that is more than about 5 minutes on a YouTube video, there's no way that younger generation's going to watch it because they realize they don't have the anterior cingulate gyrus to actually process this for very long. They can only do very short snippets. And this is something that is, of course, very concerning. This is why learning is the ability to learn. You know, and there's also something called a Google effect that a lot of people have today. The Google effect is this: we don't have to remember anything. Because if I need to know something, what will I do? I will Google it. I will look it up. But the art of remembering is the art of thinking. And, you know, when I grew up, of course, there was none of these devices, and I had well over 1,000 phone numbers memorized. You know, I knew at the hospital what, you know, the numbers were for each of the floors, for the ICU, for ER. I knew, of course, my parents' numbers. I knew my friends' numbers. I knew a lot of my faculty members' numbers, and I would never have to look up their numbers because I had associated those numbers. And, of course, this is one of the reasons as well our students are excelling at Weimar Institute. I won't give names, but we've had many individuals that have taken the science portion of their MCAT and DAT, this is the entrance to medical school and dental school, and they have not missed a single scientific question. Got all of them perfect. Now, what is the reason? How are we teaching them in this way? What happens, and the one who teaches more of the science classes that is on this is Dr. Harris, who's a brilliant chemist and also a biochemist. She actually worked for the pharmaceutical industry as well before she came, so she's a very highly successful chemist and well-touted, has impeccable references. But actually, this is another story in and of itself. As a result of her biochemistry studies, she began to realize that there had to be design in creation. She was taught in the evolutionary theory, but she realized, wait a minute, this biochemical pathway could not have come first and then this one. There had to be several of these all together in design format, otherwise it would have never been able to occur. And she began to recognize there was a designer and things like that, and it finally led her to the Bible, and then led her to want to teach at an institute at Weimar. In fact, people wonder, do you have academic freedom at Weimar? You know, what about academic freedom? She says, I have much more academic freedom at Weimar than I did at the University of Colorado, because she's able to actually teach out of, you know, the truths of both things. But what she will do is she will teach an organic chemistry concept, and she will parallel that with a biblical concept. And so the students, when they come to an MCAT exam, they're always teaching them, or not teaching them, they're always giving them new problems that they've never seen before. Why are they doing that? They're wanting to see if they can think. They're wanting to see if their frontal lobe and their judgment and wisdom are enough to get into medical school, because you don't want to make mistakes in judgment when you're a doctor. And so with these new problems, the typical student will see that and say, there's no way. I've never seen this problem. I don't think I was taught this at all. And our students have that same mindset when they see a new problem. It's like, whoa, I'm not prepared for this. But then they'll look at the problem a little more closely, and what do you think they remember first? They remember the biblical concept. Then they'll remember the organic chemistry concept, and then they'll solve the problem. Why? Because of this association. It's far easier to remember two things and associate it than it is to remember one isolated thing that's out there. And this is one of the reasons why learning has become such a challenge, because of this whole Google effect. We're not having to associate things together, and if we are not able to associate things, we're not going to be able to have things in memory in our temporal lobe long term to be able to retrieve them. And so the advent of all of these smartphones has actually created an enigma that a lot of the scientists are talking about, because the current generation actually has more arrogance in regards to what they think they know. But that we're actually find out they're the most gullible generation. They're able to be easily manipulated and fooled because their brains are not stocked with things that they know are absolute truth. And so when they hear something like this, even though it makes zero sense at all, because their memories aren't stocked with these facts that are true, they all of a sudden latch onto something that is completely untrue and will get emotionally attached to that. And then there's all sorts of problems that result as being the most gullible. And this is something that's being talked about. I mean, you can research this out, and this is something that our expert also is going to be talking about at the EQ Summit. Occipital lobe. This is where our vision is centered. It's also where visual orientation is centered. IQ is based on some of those things, our architectural skills, our ability to design has to do with occipital lobe. Parietal lobe is where language is at. When you're learning a new language, your parietal lobe is being expanded. But also calculation, division, subtraction, math skills are there in the parietal lobe. Einstein, when he gave his brain to science, was found to have a little larger parietal lobe than most others. Cerebellum is where our coordination is centered. And when teams get together to compete, they're actually determining which team has the most corporately developed cerebellum, or at least the one that's functioning best that day. They don't realize that's what they're doing, but that's precisely what they're doing. And then the frontal lobe is where, as mentioned, EQ and IQ go together. In regards to our brains, of course, other creatures have brains as well. A cat, I didn't realize how small a cat brain was till I was in high school biology and dissected a cat. And the last thing we got into was the brain. And it's not a very large brain, but what I didn't realize, because I didn't know all the lobes at that time, that only 3.5% of a cat brain is in the frontal lobe. What does that mean? Not much morality in a cat. If you've seen the cat torture a victim to death and actually enjoy the process, you know, anyone who enjoys torture, it's a sign of serious frontal lobe compromise, and the cat thoroughly enjoys torturing that mouse to death, and it's kind of shocking to see it, but that's because of that low frontal lobe ability. Dogs have a little more frontal lobe, 7.5% of their brain is in the frontal lobe. And that's what gives dogs the ability to actually empathize more. I don't know if you've noticed it or not, but your cat doesn't really care whether you're home or not. But your dog is actually very happy to see you and happy to reestablish that relationship with you when you come home because of that larger frontal lobe. They will also have, they don't enjoy torture. Now, they're not the most moral creatures. They will murder if they have to, but they do it much more mercifully. They're not into torture, and also they're able to. You know, I just came back from Africa a few weeks ago and was out there in the Serengeti, and the tour guides were telling us the difference between the cat brain and the dog brain in regards to their preys out there, because there are wild dogs and all sorts of different breeds that are out there in Africa. But they said the cat, it just has one plan. And if it doesn't catch up to its prey in 90 seconds, it's done. It just goes from point A to point B. But with the dogs, they'll actually plan. They'll actually get together, and without corresponding at all, they know that they're going to chase the prey over to this direction, then this group will come in and do it over here, and they're 3 or 4 steps ahead, and they're of course, that's the frontal lobe, that ability to accomplish that advanced planning and thinking. Chimpanzees have the most of any other animal creature. 17% of their brain is in the frontal lobe. But what sets us apart from the rest of the animal kingdom is our frontal lobe size. 33 up to 38% of the human brain is in the frontal lobe. And that's what gives us the ability to accomplish advanced planning and thinking. This is a quote from Guyton's textbook of physiology that's used in medical schools throughout the country. Scientific studies show the frontal lobe is the seat of spirituality, morality, and also the will. And so this is where willpower, our ability to have self-control, is centered here in the frontal lobe of the brain. And when the frontal lobe is compromised, we will see a number of effects. Moral principle goes down. If we want to follow the decline of morality in an individual or in society, the answer is going to be in the frontal lobe. Social impairment occurs. It's natural to love family members, but when that natural love for family goes away, it's often due to frontal lobe compromise. Lack of foresight, our ability to reason from cause to effect, is a frontal lobe phenomena. You can even follow your child's frontal lobe development by how far they're planning for in the future. Abstract reasoning is impaired when the frontal lobe goes down. Our ability to interpret proverbs goes down. Mathematical understanding is diminished. Now, I talked about calculation, division being parietal lobe, but higher forms of math, calculus, and higher forms of algebra require the frontal lobe. By the way, calculus is one of those subjects taught at Weimar Institute because we're also very much a research institute. By the way, Weimar not only became accredited, but just a few months ago, we have our own institutional research board. So this is where we can conduct the very high-end studies that get published in major publications, and many of our students and professors are published on a regular basis in peer-reviewed journals and are asked to speak at conferences. 4 of our students last year were asked to speak at Harvard University and went out and spoke at Harvard in regards to some of the studies that are going on there. But of course, in order to do studies on the high-end aspect of things, that's where math comes in. People wonder, what's the application of math? Well, if you want to speak in today's language and research, it has to come down to measurements and statistics. And of course, calculus puts you on a higher playing field in regards to that. But calculus does require the frontal lobe. You've got to, it's not just, calculation division, which would be parietal lobe functions. Loss of empathy will go down. When the frontal lobe goes down, our ability to understand what someone else is going through goes down. And studies show if you have a well-functioning frontal lobe, you can just hear about what happened to her, and you will feel precisely the same feelings. You don't have to have gone through what she's gone through to be able to feel precisely the same feelings. Now, that's true if you don't have a good frontal lobe. There's no way you're going to be able to empathize because you can't identify with it. But that's one of the advantages of that good frontal lobe. Lack of restraint tends to occur. Boasting, hostility, anger, rage, emotions that are out of control also occur. And then there are character strengths that actually go up when the frontal lobe is enhanced. One of those is creativity, and there's two essential components for this, being original, meaning that nobody has thought of this before, but also adaptive, meaning that your originality makes a positive contribution to the life of others. There are some people I know in today's world that pride themselves of being very creative, but in reality, they're just very bizarre. In other words, they haven't done anything that's useful with their creativity to enhance the lives of others. In order to have true creativity, you need to have both of those things. And that underscores, again, why people who have higher intelligence, because this is part of intelligence, your creativity part, can go from the lowest echelon status in the economy to the highest in a matter of a few years, because once they come up with something that's original and useful to others, and if it's useful to a lot of others, they can put that into manufacturing, into practice, and they can, of course, turn that into wealth. Interest also goes up in the frontal lobe. Have you noticed the younger generation, if you take their phones away from them, it's like, I'm going to be bored now. What am I going to do without my phone? This is actually a sign of significant frontal lobe compromise, because if you don't have a phone or something to distract you, if you have a good frontal lobe, you're going to be interested in everything, and it's fun to interact with someone who's intrigued by everything. And as this book, secular book, Character, Strengths, and Virtues, says, if curiosity can be cultivated, which it can be by enhancing the frontal lobe, no one need ever search for interesting experiences. One will simply have them. And so you can take some young person with a very good frontal lobe, and band them to this room for hours. And at first they might be disappointed. Why is it that I'm being banned to this room? But by the time you would find them and tell them it's okay to leave the room, they're not sure they want to leave because they would be studying something that's highly interesting to them. So people with good frontal lobes, they are enjoyable to be around for that reason. And then judgment goes up. Your critical thinking, rationality, which is what we've been talking about. And of course, it feels good. It leads to good decisions, also leads to a coherent view of the world. Love of learning also goes up considerably. And then wisdom. What is that? It's the comprehension of what is true or right, coupled with what? Optimum judgment as to action. You might know something that's true and right, but if you're not coupling it with optimal judgment in regards to wise action, then of course that's not wisdom. Kindness and empathy go up. Social intelligence also goes up considerably. So there are a number of ways in which we can suppress our frontal lobe. And one of those ways to suppress it is drugs. Whether it's heroin, whether it's opioids, whether it's meth, whether it's cocaine, all of these recreational drugs by design suppress the frontal lobe of the brain. That's one of the reasons why people like to use them. It can actually feel good to have your limbic system take over your judgment at first. And it is, of course, this is why marijuana has significantly increased as well. Marijuana is a powerful frontal lobe suppressant. These drugs, and of course, it's kind of baffling to hear the rationality behind marijuana. I know Oregon is a big marijuana grower, and I know Northern California is a big marijuana grower as well. And it is, the rationale for it. And of course, if you get online, you might think it might cure every disease known to mankind now, because it's used for all sorts of different disease treatments. But there are disease treatments in 99% of cases that are far better without the risks of frontal lobe suppression. But there's no fascination in regards to the things that are only beneficial and have no risk. You don't hear the write-ups about that. So the world is fascinated with things that might have some benefit, but then there's that risk or that hook that's on there. And of course, with marijuana, that hook, anything that's a frontal lobe suppressant actually does have a hook, and so it ends up decreasing your motivation for just about everything else in life except for where you're going to get your next marijuana from. And it increases your motivation that way. In fact, we have a lot of marijuana users come through our program, and one of the characteristic elements of the typical marijuana user is they will tell me, I have no self-control whatsoever. And what I have to teach them is everybody actually does have selective self-control. And they'll say, I have no self-control. But then I talk to them, and they're very careful about the soil that their marijuana is in. They make sure it's watered on time. They much do have meticulous self-control in regards to their marijuana. But the other aspects of their life, they don't have that control over. And then there are prescription drugs that impair the frontal lobe. This is why we have to weigh the benefits versus the risk. One of those I discussed with a number of people today that are on the benzodiazepines. I mentioned this with Christie's case, and so that triggered some people to come forward and talk to me about their lorazepam or other things that they're on. And these benzos actually were only meant to be utilized and designed for short-term, acute, panic or acute types of very uncontrollable situations. But when they're used on a regular basis, they actually will decrease your ability to even make GABA-aminobutyric acid in your brain. And that's what we need in order to be able to manage our emotions when there's stressful situations going on. And they're also powerful frontal lobe suppressants. Many people in the medical world talk about alcohol in a pill, essentially, in regards to these things. And the world doesn't necessarily know how to get you off them. In fact, if I were in charge of the FDA, which I'm not looking for that job, so don't call the FDA to try to get me in charge of it. But if I were in charge of the FDA, I would not allow any physician to prescribe benzos. Because the typical physician, actually, believe it or not, psychiatrists are far more wise in prescribing benzos than non-psychiatrists are. Because psychiatrists know about that hook. But the family practice doctor, when they see someone with anxiety, they know that as soon as they start taking this benzo, they're going to feel at peace with the world, and they're going to say, I finally realized my problem. I had a Xanax deficiency. And they're at peace with the world for a while, but then that tolerance develops, and of course that filling the GABA receptors, and now the GABA goes down, and after 30 days, if they try to stop their Xanax, they have tenfold the anxiety of what they had before they ever got on it to begin with. And so it has this tremendous hook. And then the typical doctor will say, don't ever try to get off of that. Because you're not going to be able to get off of it. Don't ever try to get off of that. And fortunately, we've actually published that. In fact, we're going through another study, another one to just present it to our IRB in a nice comparative study. But our program is highly successful in getting people to be able to be off of benzos. Just in our last program, we had a lady who was on benzos for 20 plus years. And she particularly began to crater when her husband died just recently. And then she started using alcohol on top of the benzos and all of this sort of thing, and just began to crash. Fortunately, she was part of our at Weimar Institute. This is another thing that's kind of unique. We're the only college we know of that empties out every week on Wednesday at noon, and all of the faculty and students do community service in the community, and they serve the same section of the community, and they get to know all of the people in the community and see what their needs are. And it became very clear that she had significant needs. So first they were helping her yard to clean up, and then they were cleaning her gutters, and then they were doing things to help her with the daily aspects of life, and then they realized there were some deep issues. And so on Wednesday afternoon, I also have a free clinic for TCI people, and so they sent me over there for a house call. And of course, it became very clear at that point with her benzo usage and all of that, that she needed some more thorough work than just one visit would give her. But she began to understand that there was a way out of that. And the Lord opened up the way for her because of donors in the local area that knew about her case to actually send her through our program. And she was very fearful of getting off her benzos. She just says, I'm not going to be able to do this. And I actually switched, first she would switch over to clonazepam, but there's something even longer acting than clonazepam called Valium, and so she was on Valium, and so we were taking it down piece by piece, little by little. And she got to the program and she says, I'm already full of anxiety and I can't go down further more than this. I said, you are on the right dose to get off of this. By day 7, she took her last benzo, and she is off of her benzos. It's been, she went through the October program, so it's been over a month, and she is already full of life. The new Jenny has emerged, and she's got a great sense of humor, and she's managing her emotions, and she is now getting a full-time job, actually, at Weimar Institute. She's going to be working in the Weimar. She's so thrilled to be working there at Weimar in such a supportive environment. But you can get off of these opioids and these benzos. By the way, opioids are even easier to get off of. We had our nurse who works in our clinic, Kelly. She went through our program a year ago, and she was on 400 milligrams of OxyContin a day. For those of you that know opioids, that's a huge amount of narcotics. And it was over $50,000 a year drug habit. You know, she's a girl in her 30s, started out with first alcohol, then marijuana, it goes through all the cycles, and then finally it got to these opioids, and her life was in shambles, relationship in shambles, child out of wedlock, just a life in complete disaster. And she was an LPN, and she decided, I can't live my life this way anymore. And so, and by the way, this is also kind of curious. How did she get on those opioids? She was pregnant with the child out of wedlock, and she had a kidney stone. So she was put in the hospital with a PCA pump, giving herself narcotics with this kidney stone for a week while she's pregnant, and sent home on OxyContin. So that's how she got hooked. And then, of course, she developed that tolerance and all of that sort of thing. And so from 400 of OxyContin, she went down to 0. Now, she went to her grandparents' place. They were the only, her relationship with her parents was terrible. They wouldn't take her in. but her grandmother still loved her and said, I'll take you in. And so they let her be in the house as she got off this 400 of OxyContin. Now, benzos, you don't want to do that, because if you go down from benzos to high dose to 0, you can actually have a seizure. You know, it can be dangerous. This is why even high amounts of alcohol, if you're on high amounts of alcohol for years and you stop it abruptly, delirium tremens. But opioids actually increase your risk of seizures, so when you get off opioids, your risk of seizures is none. And so you don't die from opioid withdrawal. It just produces severe dysphoria, and you can get some physical symptoms of it. She got those physical symptoms of diarrhea, because opioids cause constipation. So when you get off of it and your body's adjusted over to this, you're going to have some significant diarrhea. You're going to have some stomach upset. And by day 3, she had all the symptoms of severe dysphoria. As she's trying to do this on her own, and the diarrhea, and she started getting sick and nausea and vomiting. So she went to the ER, and what do you think the ER wanted to do? You're coming off of that much OxyContin, let's give you some IV morphine right now. And she says, no, I don't want that. Don't give me any opioids. So they gave her IV Zofran to help her with her nausea, and they gave her a couple of liters of IV fluids, and she got better. And she didn't have insurance, so they didn't admit her, and she got sent home. And it was a 30-day process for her. She did have chronic pain, but she said after the 30 days, she had no more pain than what she had ever had. But now she was able to manage it, and she had a frontal lobe. But she had another issue behind that. She hadn't come to our program yet. And now that she wasn't self-medicating, the underlying problems of depression started to manifest themselves even more, and she started to get suicidal. And this is why I know that there's a God, because of all of these stories we'll have. She was actually going to end her life. She lived in a very busy city, and she was going to run out in traffic. And she was looking for the traffic person, the traffic car that was not going to stop, that was going through the light and jump out in front of them. And she had that look on her face, and one friend who wasn't going so fast went by and recognized her and put her window down and says, "Kelly, are you okay?" And Kelly says, "I'm not okay." She says, "Get into this car." And so she went into the car, and they talked, and says, "Have you ever heard about the Nedley program?" And so she told her grandma about the Nedley program, and the next program, she was in our program. And now she has been narcotic-free since that time, benzo-free, all of this off of drugs, and now she is a vibrant nurse that's helping a lot of others in the outpatient clinic program. But don't think that people can't get off of these drugs. There is a process, but they can get off, but they need to also get to the underlying issues that cause them to self-medicate in these ways in order to have that lasting success. It's not just getting off that we're after, but dealing with those underlying issues. And then alcohol. It's legal, but it does impair the frontal lobe significantly. By the way, speaking of alcohol, if you have a glass of wine with your meal at Olive Garden and you drive home, do you have an increased risk of an accident? You're legal, but your risk of an automobile accident goes up by 40%. Once you get to the legal limit, which in Oregon I believe is 0.08%, you have an 11-fold increased risk of an accident. Now, at the legal limit, if a policeman were to pull you over, maybe you're at 0.78%, so you're just legal. Would you be able to walk a straight line? You could. You could walk a straight line. You could even, and Miguel Cabrera has demonstrated this, he's a baseball player, you can even hit a curveball out of a baseball park at that level. Your coordination is working great. Your cerebellum is working great. Why is it then that Miguel Cabrera is more than tenfold more likely to get into an auto accident on the way home from that baseball game. Because his judgment's not working. And that's what happened to Princess Di's driver. He attempted a turn at a speed that was impossible to negotiate. No one recognized he was drunk because he was walking normally, conversing normally. But his judgment in taking that turn at that speed in that tunnel, he would have not done had his judgment been okay, and he lost his life. The princess lost her life as well. But in regards to, and by the way, does it take critical thinking to drive an automobile successfully? It actually does not take critical thinking. This is why we allow college students to do it. And high school students that are in their junior and senior year. It takes judgment, but it doesn't take critical thinking.